I'm here because I strongly believe in healthcare as a human right.
Rendon, shame on you! Action now!
I'm here because I believe health care is the most important issue for this country.
I am a California registered nurse for California Nurses Association nurse, and I am here fighting on behalf of my patients.
I believe that SB 562, the Healthy California Act, is a really strong, powerful way for us to move that forward.
Donald Trump cares health care plan. The new CBO report shows 22 million people will be left uninsured, and my patients will die.
We must have health care, and it has to be affordable. What we have right now is a joke.
Well, the reason I support the nurses specifically because they're the front line, and they're the ones that take care of the sick and disabled. And it's they put their hearts and soul into getting SB 562 passed. And then to find out that Anthony Rendon, the chair of the Assembly, decided unilaterally to put a hold on SB 562.
I'm here at the state capitol today because Speaker Rendon has stalled SB 562, which would provide health care for all in the state of California. We need it moving along so we can work out all the details and get health care for all.
So he, on June 16th, decided to pull a bill that had been worked on for months and months and months. The bill was authored in the Senate by Ricardo Lara and Tony Atkins.
I'm here today to urge Speaker Rendon to release the bill.
Completely unexpected, at 5 o'clock in the afternoon, the bill was pulled on a Friday.
That to me kind of defeats the purpose of why you have a committee in the first place that reviews, evaluates, assesses, and evaluate and come up with a solution. This is not a solution.
It did not give enough time for our organization, California Nurses, to respond.
This is just avoiding the issue because healthcare is so critical for people.
When you go to these committees, you're still working on it. He knew all of this, and yet he put out inaccurate information, including the myth of the $400 billion. That is not an accurate figure. Using Robert Pollin from the Perry Institute, it is an 85-page study of what things can be, and it will be worked out financially. Rendon knew this, the media knows this, and yet they continue, the print and electronic media and Rendon, to say this is going to cost $400 billion. Absolutely incorrect.
Every industrial country in the world has it, but the United States of America. And why we don't have it? Because our country is being run by politicians, by lobbyists, and insurance companies and pharmaceutical companies.
What we're saying is, first of all, Speaker Rendon, just let the bill go forward in committees. You are an appointed person. These individuals in these committees are elected. If they don't want to vote for it, fine, don't vote for it. But give us the chance.
We need single payer, and the time is now, and Anthony Rendon is holding this bill hostage, and he needs to do the right thing and stand by his constituents and release this bill so that we can get coverage for everybody.
I need it really bad for my daughter because she needs it for survival. And I'm here because I need my daughter to survive, and my grandson needs his mother to survive.
Yes, there will be an increase in taxes, but people will no longer have insurance premiums, deductibles, co-pays. When you have a car insurance policy, that part that deals with medical will be gone. When you have a house insurance, a renter's insurance, and it deals with medical, gone. So it really works out to less than what people are spending now.
Healthcare is an issue that every single person in California deals with. Our system right now is broken. We need this bill to go forward. We can work on it. We can add amendments.
If a business is grossing less, or $2 million or less, they will pay zero taxes. Zero. But the AP Newswire didn't put that in there. They just said it's going to go up to 2.3%. It's still cheaper than anything that any business is paying right now for insurance.
My son is 35 years old, he's 6 feet tall, autistic, and over 180 pounds. And my husband has a weak heart. So this is very personal for me. This is do or die.
This is so important to move this bill forward, to work towards single payer and healthcare as a human right for every person in California.
Washington, D.C. is threatening my son's Medicare and Medi-Cal, which he relies on for everything. Housing, medicine, day programs. If they take that away from him, he's homeless.
Tell you is that people are going bankrupt right now. People are losing their homes. People are homeless. If you look, each legislator will bankrupt 1,350 to 3,100 California families in their district every year. Every year. And I can tell you, I have worked in homeless shelters, and I can tell you that not all these people are drug addicts and alcoholics. Some of them, and I've held the babies in my arms, are people who've lost their homes, their apartments, because of a medical bill. Well, guess what, folks? If you pass SB 562, whoever's listening, you please call. Just go on the internet. I can't go through this right now. Go on the internet, call your assembly person. It already passed in the state Senate. Now it's up to the assembly, and if it doesn't happen now, we're going to have to wait another year while they fiddle in Washington.
I'm here to support SB 562 so that everybody can have health care.
And one last thing, Canada has single payer. This is not where the doctors are owned by the government. It is single payer. There's a difference. It started in Saskatchewan, one province, and little by little, each province decided that they wanted to have this until it became the law of the land. Here in California, we're the 6th largest economy in the entire world. And the entire world, industrialized world, has this kind of, or a variation of universal health care. If we can't do it, nobody can. And you know what? We can do it.
At the national level, if the Trump care goes through, I think a lot of people are going to get hurt. And I think this is the bill that can protect at least the Californians from what's coming on.
This is what democracy looks like. This is what democracy looks like. Tell me what democracy looks like. Billions will save on administration. We'll lower costs through negotiation. With what we'll save, we'll treat every patient. This plan was made for you and me. This plan is your plan. This plan is my plan. From Mendocino to Escondido, healthcare for all is all we're asking. This plan was made for you and me.
Just go to YouTube. It's a 38-minute video. I encourage everybody to watch this. You will learn everything that you need to know.
I want people to save the planet, so let's save the people with a good health care program.